Hi, everybody, and welcome to today's webinar, Starting the Future, the Promise of Price Transparency. On behalf of Becker's Healthcare, thank you all so much for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions. First, you can submit any questions you have throughout the webinar by typing them into the Q&A box that you see on your screen. Second, today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. Third, if at any time you're having trouble with audio or visual, try refreshing your browser. You can also submit any technical questions into the Q&A box, and we are always here to help. With that, I am so pleased to introduce today's presenters, Christy Skalka, Managing Director at Deloitte Consulting, Chris Murray, Senior Manager at Deloitte Consulting, Jeff Pasqua, Vice President of Product Management at Deloitte Consulting, and Patrick Kowalik, Industry Professional at Snowflake. Thank you all so much for being here today. I'll now go ahead and turn over the floor to you to get us started.
Great, thank you so much. So I'm going to go ahead and get started with our introductions. Good morning, afternoon, or evening, depending on where you are. My name is Christy Skalka, and I'm a leader in Deloitte's healthcare practice. I'm out of the Austin, Texas office. I'm an actuary by background and started my career in healthcare right when the Burgess bill passed under George Bush in 2004. And it was the first major healthcare price transparency law. And since then, price transparency has escalated quite a bit. So the majority of my career, though, has been focused in revenue cycle end-to-end transformations on the health system side. But since the new transparency regulations have kicked into high gear, I have really become focused in the last several years on supporting healthcare and life science clients in price transparency, pricing analytics, contracting, networking strategies, and specifically the move from fee-for-service to VBC and pop health. So very nice to meet all of you, and I'm going to turn it over to Patrick to introduce himself.
Sure, thanks, Christy. Hi, guys. Patrick Kowalik. I'm with Snowflake. I'm one of our industry principals for healthcare life sciences. I've been with Snowflake for 2.5 years, also in Austin, Texas. And before Snowflake and leading healthcare strategy from the data side, my background was in the payer space. I was a senior VP for one of the major states within the Centene family, and so price transparency was at my forefront all the time too for analytics. So great to join the conversation. Thanks for having me. And Christy, go ahead. Direct who's next.
Chris, can you go ahead and do your introduction?
Yeah. Good morning, good afternoon, good evening, everybody. Thanks for joining us. I know we have a big audience, so appreciate everybody taking the time. So I'm Chris Murray. I'm a senior manager. I've been a leader in our healthcare pricing and payer strategy practice for over 10 years. I like to think of what I do is bringing humanity to healthcare. I focus on issues of affordability and access. And as you can imagine, this issue sits at the heart of those two things. So really excited to be here with you today, talk about some of the experiences that we've had in the payer pricing strategy space and how price transparency is evolving. And I hope together we can start to think about where this is going and how we can make strategic investments to achieve the ultimate goal of price transparency, which is improve the health and all the health, spiritual, mental, physical, financial for our patients and members and employees and ultimately families and communities. So excited to have this conversation with you all.
Great. And Jeff, round us out.
Yeah, good morning, good afternoon, everyone. Jeff Pasqua, also with Deloitte Consulting. I'm a vice president within Deloitte's Converge Health Technology Group, focused primarily on collaborating with our clients to build analytics assets focused on our healthcare provider and payer clients, including analytics that really speak to price transparency. I've been with Deloitte for about 20 years and was working in a variety of roles ahead of my time with Converge. So looking forward to the conversation.
Great. So If you're joining this webinar, you're probably very familiar with price transparency and the regulations, but just a quick reminder that there's rules, regulations, and laws, including hospital and health plan price transparency related to the negotiated rates between the two parties. Drug transparency is a PBMs as well, and even member and patient financial transparency. So today, we're not planning to spend a ton of time, just a little time rehashing the requirements or even talking too much about the challenges of wrangling all the data, but rather we're going to talk about what the future holds for price transparency and what that will look like and how you can chart a path to that future by making the right strategic bets now. And so I'm going to turn it over to Chris to get started.
Thanks, Christy. How do we go to the presentation?
Can you not see it?
I can't see it, no.
Can you advance it?
Oh, there we are. Sorry about that, a little technical difficulty. Yeah, so thank you, Christy. 5 years ago, we predicted a future where healthcare transparency, driven by the price transparency regulations, would catalyze what we call the future of health at Deloitte. The future of health was a paradigm or a strategy that was developed all the way back in 2017. And in our predictions, the future of strategy, or excuse me, the future of health is a future where all of these fragmented systems that provide healthcare to patients today to keep them well and to keep them, both sick and, sick care as well as healthcare would combine around the consumer. And in order to do that, it was dependent on a couple of things, right? It was dependent on meaningful, timely, and personally relevant information across the patient journey. And that was in order consumer decision-making, right? It's also dependent on increasing competition to be able to serve the customer, resulting in improvement in value, reducing cost, improving quality, and expanding access. Right, what we call the holy grail, right, of healthcare, the trifecta. So while we've seen, I think, significant progress towards that future, spurred greatly by the change as a result of price transparency, I think we all can agree that we still have a lot of uncertainty. There's still a lot of progress to be made coming out of 5 years or so of this work. And together today, we're hoping to make new predictions, and hopefully we'll be able to leave this session with confidence in the investments that we're making, as well as bringing a better future of health for our communities, our patients, our members, and our families, ultimately. So how are we going to do this? Well, we have a strategic framework that I think works really well in these types of environments. What we're going to do today is we're going to together chart a path forward for transparency, but that requires really reimagining the future. So what I'm going to ask of this audience today is to forget about where we are, forget about the past. We're going to want to jump forward into the future. We want to get into our time machines, right? And we're going to jump into the future, and we're going to experience together what that future might look like and what that means in order to be successful in those futures. And so scenario planning was actually created back during the Cold War by the RAND Corporation to do very thoughtful planning about war scenarios. We're using it a little bit differently, but it has quite a history and has had good results over time. Thank goodness. But it does a couple of things, right? It's going to build capacity to actively respond to future challenges, right? To those futures that we imagine. It'll allow us to prepare, to respond, and prevent any surprises. And then 3, it'll allow us to stress test different strategies under changing conditions and be able to pick the right things to do now in order to be successful in the future, whether it's future A, future B, future C, or future D. And so coming out of that, we're hoping that you'll have a better sense of what your strategy is and maybe some shifts that need to be made in your strategy. Where does it make the most sense to invest in this area and the tangential areas to be successful as these evolutions happen? What signals to look at, right? How do we know the world is changing? It'll give us a real good sense of the things to look at to be ahead of the curve so that we're not playing catch up downstream. And then lastly, have a really concrete set of actions, right, that across the organization we can take in order to be successful, regardless of which future materializes. And so there are a couple of key elements that we'll use in this framework that I want to just quickly go over. The first is a driving force. And a driving force is kind of it's a known. It's a factor that's likely to influence or cause a change in particular direction, right? So these are the things that we know, regardless of what happens, like because of price transparency, this will happen, right? Then we have critical uncertainties. Critical uncertainties are the things that are, for lack of better words, uncertain, right? But they're significant, and that the outcomes of those uncertainties will define the future that we find ourselves in, right? So it's really important that we take these conflicting, non-correlative, critical uncertainties, and we test them, and we kind of put them on a 2x2 to understand, well, if we know that X, Y, and Z is going to happen, and the change is going to be on 2 critical uncertainties, well, that'll give us a really clear set of scenarios around what might happen, what that world would look like, and how we'd have to respond in that world. That was a lot. Jeff, you want to talk a little bit about some examples just to make this a little bit more real for folks?
Yeah, absolutely, Chris. One of the uncertainties that I'd highlight here is by who and how the foundational price transparency data will ultimately be leveraged as it evolves. Today that data is publicly available, but it's still far from publicly accessible and manageable by all the players in this ecosystem equally. Right? There's some that are a little bit ahead of others, but there's still challenges with that across the board. And so observing how that dynamic will evolve is for sure going to be part of charting that path moving forward.
Love it. PK, any other thoughts?
I agree with Jeff. Forgive me, my smile there, same thing. There's so much desire of what you want to do with this data and what you can do, and to hit those strategies. One of the biggest challenges that I've seen, and again, forgive me that I kind of represent the data side also, but it's you need a platform, you need a team, you need to be able to get this data in a way that can be looked at. This unfortunately isn't a piece of data you can just pull up in an Excel file and make a pivot table. Part of the strategy to be able to tackle this and to tackle it consistently is commitment to how do I get the data, how do I get it usable. Jeff nailed it. It's public, but it's the information is tough to have accessibility on, and then just to where Christy led from. This isn't a one-time project. It's not load it and look at it and it's frozen and we go. This data, the changes, the reactions, every time you get eyes on it, it adjusts for a reason, for valuable, all those driving forces you talked about, Chris. So that, again, it's the combination of like really complex business and equally, if not even more complex kind of data, variability. So agreed, a big road ahead.
Awesome. Well, let's hear from you. We want to do a quick polling question and really understand, what driving forces are you experiencing, and what's driving the most change related to your pricing, price transparency, the ecosystem, or the changes in your market as a result of price transparency. And it's a multiple choice answer, so don't worry. You can't, there's no wrong answer.
We have about 26% response rate. So think about it and pick the most driving force that you feel.
I don't know about you, but all of these keep me up at night.
Yeah, it's hard. These select one. And that's kind of, not to just to look ahead, there's a nice question, from the QA too that we'll probably, that we'll get into, but just talking about, hey, the quality of this and the measures and just interacting of, decisions aren't made on just price alone. So somebody is almost forecasting the slides. This is what you're going to get into, Christy.
Yeah.
Great.
We're at about 54%. So why don't we see what the results are? Ooh.
Oh, I like this. This is consistent with what we're thinking here.
It is. All right. Well, let's talk about that first one, because if you ask me and ask Deloitte, I would say that, there are many driving forces in healthcare encouraging, incenting, and compelling change. The biggest one for price transparency, I think, is regulation. Let's be honest, I don't think anybody would have made their confidential trade secret negotiated rates publicly available if the government didn't tell you to. But even with those regulations, there are still hospitals and health plans that are not posting. So this slide is a little history lesson, but also a visualization of how much the driving force of regulation has increased the amount of data in the market. And if you go all the way back to 2019, which isn't even on our graph, that was one of the first hospital charge master transparency regulations, and it went into effect that year. But there was still very little awareness of it in the market, which brings us to 2021, the start of our graph, here on the bottom left, when the hospital price transparency regulation went into effect on January 1st, and the first negotiated rates, not charges, but the first negotiated rates went public. Followed shortly after by the No Surprises Act and Transparency and Coverage. So the No Surprises Act, which we consider a patient or member transparency imperative, and is meant to prevent surprise billing, balance billing, and that went into effect on January 1st, 2022, which is also when Transparency and Coverage, which is the Health Plan Transparency Act, and it's shown there along the bottom of the graph. It went into effect on 1/1/22, but wasn't enforced until July of that year. And then there have been a few additional enforcement dates through January 1st of this year, when the plans had to make all of their healthcare services available in a member cost estimator tool. We keep trying to see if that actually happened as of January 1st. I'm not sure it's completely there yet. And then interestingly, in the middle of last year, CMS released an FAQ that said they will no longer not enforce a double negative. They will no longer not enforce the release of the drug transparency machine readable file, but then didn't say when they would actually enforce it. But regardless, there is some drug data starting to be released. And that gets us to this year, when the 2024 OPPS final rule went into effect for hospitals with some new price transparency requirements on July 1st, just a little less than 2 weeks ago. And there's still pending regulation in the House and the Senate related to healthcare price transparency. It's very much a bipartisan issue. And then interoperability and prior auth transparency are just around the corner. And the S-curve that moves from the left to the right on this graph is again meant to convey the amount of increase in negotiated rate and pricing data available in the market. And if there was ever a perfect marriage, it would be between healthcare pricing data and AI and machine learning. The size of this data, the complexity of the data just makes a perfect, again, marriage with this and AI. So with that, we're going to move into our next poll. So as Chris mentioned in the beginning, we talk about driving forces, which in this case we believe is regulation for price transparency, but then also the critical uncertainties of the healthcare landscape, and specifically those that pertain to what everyone is going to use the data for and how to prepare for those reactions. So our next poll question, what critical uncertainty related to pricing most keeps you up at night? I think there are a lot of good options on here, but you can only select one again. And these options were chosen because we hear about these from our clients all the time. A recent comment just last week from a client on the East Coast was, given KP's launch of Verizon Health, what if KP lands in our backyard and starts challenging rate levels in this market? So a very real critical uncertainty for that client.
Yeah, the other one we hear a lot of is as we're getting to election season, right? Cost, price becomes a talking point in the political environment.
And like I mentioned before, it's still very much a bipartisan issue, regardless of kind of the election results. It's also bicameral, meaning it's supported by both the Senate and the House. So right now, both the Senate and the House have future pending regulation sitting there waiting to be released around healthcare price transparency. All right, we're at about 48%. I'm gonna see if we can get to 50, and then we'll move into the results. Just a couple more. All right, let's look.
That's great.
Lots of critical uncertainties. A good distribution here.
Good distribution.
Competitive reaction of the market. Unpredictable consumer engagement, though, has a pretty low number, but it looks like a pretty even spread, with shifts in the political environment being the number one. So let's go ahead and move into what Deloitte believes those critical uncertainties are. And to go just a little bit deeper on critical uncertainties, we want to formally define the word uncertainty for you. And uncertainty arises from probability, ambiguity, and complexity. And if those three words don't describe healthcare better than anything else, I don't know what other words would. So probability, meaning what is the amount of risk in the future that is going to be present? Ambiguity, which makes it really hard to make decisions. And then finally, complexity, which causes the environment to be hard to understand, right? It's just, and healthcare is probably one of the most complex industries in the world. But it's our opinion that the two biggest uncertainties driving price transparency specifically are the level of market competition and the level of consumerism. And the reason we believe these two are the most important, and you'll see how we develop scenarios from these, is going back to the original regulation. If you read the preamble of the Consolidated Appropriations Act, which, like the price transparency nerd that I am, I did, the twin intentions of the regulators are clear. The first is to increase competition by shining a light on the one secret, now negotiated rates between hospitals and health plans, with a goal of containing cost, improving quality, and perhaps most importantly, encouraging innovation. The second intention of the regulation was to incent consumerism. And the way they were thinking of doing that is let's improve the patient or the member's financial experience through pre-service cost estimates and cost estimator tools for shoppable healthcare services. And then on 1/1/24 this year, like I said, for all health plans, every healthcare service, not just shoppable, had to be present in the estimator. The last comment I'll make on this is the health plan transparency rule also allows health plans to take credit for shared savings programs and made to members, so as part of their medical loss ratio calculation. And when those shared savings results from plans incentivize they're meant to incentivize members to shop for and obtain services from lower cost, higher value providers. And so the uncertainty comes from not knowing the level of competition or consumerism that will occur given the data that's hit the market. So let's see how mapping these two spectrums creates plausible scenarios of what a potential future could look like. Is there a question for me?
There is, Christy. I think the audience wants to hear a little bit more about how quality measures interact with price transparency. And I mean, I can just talk before you give a little bit of feedback, but we couldn't agree more, Charles. I think the challenge, and as we look through the next scenario, is that pricing data has become really accessible and available, but it's created this super focused, kind of myopic focus on price without any consideration of all of the other value levers that really drive decision making, whether it be access or availability or outcomes or bedside manner. Right? Everybody has a different set of values that, for them, drives the value proposition. So it's a great point, Christy. Love to hear your thoughts on it, but we'll definitely talk more through the session.
Yeah, of course. I agree with Chris. I think there is a bit of a myopic focus on price, but what our clients are starting to realize is that when you pair price with quality, it creates a value narrative that then you can take to all of the stakeholders, whether those stakeholders are patients, and you can talk about the value of your healthcare services, whether they're members, and you can talk about the value of the healthcare network, or employers, maybe as a consumer, where you can talk about the overall cost savings from that come from high quality, lower cost networks and hospitals and providers. So we absolutely believe quality is a big piece of this. I'm going to go ahead and jump to the next slide.
I was going to say, Christy, I think that's that's what we want to see on that consumerism side. It's bringing together all the pieces you're talking about. So it's not just a price comparison. I love how Chris said it of, what is your success rate? What is even your utilization rate on price? What's your quality outcomes? What language is spoken, accessibility. So I agree. I think that's where it's shifting to. So that's the beauty of that second point of what they were trying to stimulate, is bring in all, and maybe where I'm going or setting up is that is why that becomes so complicated, because it can't just be parsing an MRF and presenting it back. You got to be able to merge it and present it to all your data points. That is the whole market. So very much agree. I love that question. I saw it when he posted it. Sorry, go ahead, Christy.
Yep. I'm going to move us ahead to the next slide. So back to kind of the twin intentions of the regulation, like if we're increasing competition in the market and incenting consumerism, which we're going to consider our two most important critical uncertainties, we have graphed those two intentions as the X and Y axes here. So the X-axis, left to right, is consumerism, and the scale goes from the far left, where there is no change in consumer behavior, meaning they're unaware and don't use the newly available cost estimators, and they don't use any available pricing information to change their decision making. I can't tell you how many CIOs I've talked to who tell me how much they've spent building cost estimators and having so few people use it. To the right of our spectrum, though, is where the rule is starting to work, and consumerism around healthcare has increased, so much so that consumers are truly shopping for healthcare based on their understanding of the relative value, back to that price and quality equation, for the services they've received. The y-axis then is the market, where at the bottom of the graph is a market that largely ignores this data. To the top, where the market is very reactive and uses this data to its full advantage, and all of the use cases that were talked about for price transparency data are being addressed by transparency and full interoperability of this data. And what this graph then results in is 4 plausible future scenarios defined by the uncertainty of where the market and the consumers are going to fall along these spectrums. So our bottom left scenario, consumers are still unaware and the market is ignoring the data. We call that business as usual, and transparency is still considered a regulatory initiative and not much else. I would say we're probably out of that one by now. It's been about 5 years in total for price transparency, and I think some things are starting to move. The top left, which we call all eyes on the money, is consumers are still largely unaware and not using the tools, but the market is starting to use the data opportunistically and mostly in contract negotiations. And the market is primarily thinking the use case is competitive intelligence. Now we move to the bottom right, which we call a consumer's world. And in some ways, this quadrant really represents what the regulators were looking for in terms of the spirit of price transparency for patients, which is to improve consumerism. And patients are agents of their own healthcare decision-making, and they have all the tools, data, and information necessary, personal, and timely to make their decisions. And then the top right is what we call 360 degrees of transparency. This is where both of the intentions of the regulation come into play. Increased market competition that is 100% focused and centered on the patient, who is at the core of their own decision-making. So I'm going to bring PK into the conversation. Kind of what are your thoughts on the plausibility of these scenarios? Do they seem realistic to you?
I like your breakdown of all four of them, and I think it depends on the day of the week or who you're talking to and what line of business as to where you may be. But again, from my view, I do see a lot of the focus is the shift into that, eyes on the money. It's, that's one of the things that gets a little frustrating is just, the actors in the ecosystem are still using this data in such silos, for their advantage and for their pricing. And so the seclusion of where it needs to be collaborative or back to the consumer is still a little, still a little filtered out. So that's where, and that's the shift. I think you kind of even outlined it nice that, I would hope that the audience would agree that we're not just in the pure business as usual, but shifting up. And, this is the nature of a life cycle, but it is, and some of it could just be data accessibility, could be the challenges, could be, just exposure, the variability, but who has access to the data? That's where I run into that the most on, is you're using it for the intent that can best help you or to remain compliant or to be strategic. And that's kind of where I see it. So I'm excited to see where other actors have shifted into some of those other four. But yeah, that's my take. I think it's a good breakdown. I think none of them are blocked off. I think they can all get there. And I think that's what we've seen is the shift over time.
That's a great point. And it's a question I get a lot actually when we go through scenario planning exercises with our clients. So Jeff, that question would be like, can you be in all of the scenarios at once? What do you think?
Yeah. If you consider this framework across different markets, different geographies, different sets of stakeholders, or even different healthcare service archetypes, I think in that sense, yes, you can absolutely be in different scenarios at the same time based on where you fall in some of those some of those different lenses. The other thing I'd add is that, these are not for black and white categorizations. It's very much a spectrum, and barring any real significant further shocks to the system, so to speak, we'd expect to see relatively slow shifts in where we're falling over time. Versus dramatic sudden shifts, again, barring any legislative or the like advancements.
Yeah, agree. All right, now that we have our four scenarios, let's talk about how we determine what scenario we might actually be in. So we would need to first measure that north-south axis, the market reaction, along a spectrum from, again, them ignoring the data to fully utilizing the data. And to measure the market, we look at signals and triggers in the environment. And the biggest signal we all see right now is the usage of price transparency data in negotiations. So between health plans and health systems, and in fact, the number of contract terminations and out-of-network stalemates have increased 700% in the last 2 years. So quite a bit. And you have to ask yourself why. And the reason is straightforward and probably not a surprise. You have all of this data in the market, and there has been no shortage of analytics of that data, and that has started to really show high levels of price dispersion. And according to a recent McKinsey study there in the footnote, on average, price dispersion analysis has shown the top quartile of payments to be 30 to 40% higher than the bottom quartile for the same set of inpatient services. And the fact is, even we at Deloitte have ingested all of this data. We have a tool, and we've developed curated analytics for our clients to support them in this negotiation process. And these data sets are just too large and too cumbersome and too complex to really analyze without kind of sophisticated data engineering and analytical tools. And then that leads to the second signal, which we're starting to see. The illumination of that price dispersion is also starting to give ammunition to employers and employer advocacy groups who are becoming increasingly savvy with price transparency data and starting to ask tough questions with a focus on the ERISA and fiduciary responsibility of employers to push on healthcare cost and value. And then finally, while still a very small percentage of the overall market, the market is starting to respond and invest in price transparency platforms related to direct-to-employer, supporting direct-to-employer products. And those products are really starting to evolve also from the traditional agreements. And these signals tell us that the market is definitely not ignoring the data, but is reacting to it and starting to use it. However, I think when the full drug data hits the market, we may be starting all over again. But let's go ahead and move into our third polling question. And this is just to understand if we're reading these market signals right on the industry using this data. So it's a pretty straightforward question and answer, and in general, we find most, if not all, of our Deloitte clients want to use this data. Have heard there are still pockets of healthcare stakeholders that don't even know this data is out there, or if they do, they have really struggled with using it to their advantage. So we're going to give you a minute to respond. We were trying to figure out it's either yes or no, but then we thought there may be some of you that don't actually know if your organization is using the data. So we wanted to throw that one in and see where we landed. Okay, we're up to about 30%. Maybe just one more second. See if we can get it up to 40. All right, let's look at the results here. Ooh.
Wow. Yeah.
Wow. Jeff, what do you think of these results?
Yeah, this is interesting. I think an emphasis on the hospital published files, if someone had to pick one versus the other, versus the plans, just speak to the level of complexity and volume of the data in the plan published files that everyone is really still dealing with and figuring out how to make heads or tails of in an economical way. So I think that makes a lot of sense. I think as on the flip side, with utilizing the hospital data or a combination, especially as we're seeing, with the 7-1 legislation in particular, greater consistency in the hospital published data across the, across geographies and approachable as well. From the clients that we've been working with, they are starting to trust this data and the results that they're seeing from it more and more. If we were to take this same poll a year ago or 18 months ago, I think there would be a lot more in that top and bottom bucket here. But certainly as we're progressing, especially if clients have been able to find a strategic partner to help them curate and normalize and enrich this data with other data sets that are complementary to it, we're starting to see more and more trust placed in the data, which I think is reflective in the audience's answers here.
Yeah, and I'm hoping to. What caught my eye, Jeff, was if almost a third of the responses are either no, we're not using it, or we're unsure. Please, hopefully that's why you're joining one of these. Is you're like maybe the context behind that choice is I just don't know where to start, or our friend Jessica in the Q&A kind of said, hey, I'd love to, but the data sets are just so big. So please, if you're engaging on that's kind of what we're talking about. Is there's nothing that's probably more valuable in intent, but it's just really hard. So, if you're not going at it, my first reaction to, Christy, you asked it, Jeff, but it's just such a valuable asset to have that data, usable. So reach out, again, there's networking here from this team. If you're like, hey, where do I start? Please, let us help, because it's so valuable. You can figure out so many insights. And then, sorry, not to beat the horse, but to Jessica's point too, it may also be, hey, the first time we got it in, we moved mountains, but how do you continually get it? How do you grab it quarterly or or semi-annually at minimum, just to see what's changed? Because it doesn't end. So that was what caught my eye the most on the results. Is that a fear? Is it an accessibility? So that was really telling.
Yeah, agree with all the comments. So we're going to move ahead and we're going to turn it back over to Chris to talk about how we measure the consumer spectrum.
Thank you, Christy. So as we look at the consumer sentiment, so how do we look at the uptake of price transparency by consumers, the overall engagement? Well, generally we look at that using survey testing, focus group testing, as well as looking at actual measures of activity of different technologies and platforms. And what we can find is that unlike market competition, consumer uptake is a little bit more of a nuanced story. But what's exciting, I think, is that it does show early indications of progress. So first of all, what I think is for me, the most hopeful measure is that 89% of consumers are showing a strong willingness to shop for healthcare options, particularly for simpler services, as you'd imagine, like primary care and lab work, right? When given the option, right, through transparency tools. So the demand is there, right? So clear implication to that, right, is let's start understanding how they're using the tools. What are the things that they need in order to be valuable to the consumer? And how does it fit into our healthcare system to ultimately drive behavior? I think one of the really good questions that came from David was around, how is this data even relevant to consumers? And I think, back to the answer I gave to Jessica was that, yeah, the unit cost, right, becomes, it's a difficult measure, right, to one, understand value, but also to drive patient decision-making, right? And so what's going to be critical is that these digital comparison tools are built in a way that are digestible and meaningful to the patient, right? And so, it's not going to be just the hospital, price transparency tool, right? It's going to have to be more innovative than that. And we're starting to see some of that innovation that actually shows liability, that shows impact to out-of-pocket cost, right? So there are a number of places where patients are really impacted by the price itself, right, in relation to their benefits. We're also seeing innovation in benefits themselves, right? So creating a transparent or price transparency enabled health benefits that incentivize patients to pick providers that have a higher value proposition, right? So coming off from that high note, unfortunately, the data shows that we're still not there as it relates to what consumers need. So looking from last year, 2024, back to 2023, we actually saw a decline from 79% to 68% in using a transparency tool. And not just that, 34% of users encountered errors, right? And of that population, those that encountered errors, not only did it deter their care, but they also lost trust in that provider, that plan, whoever was reporting on the data, right? And as we know, trust is one of the most important things to drive consumer behavior, to drive loyalty, to drive decision-making. So we need to be able to focus on data accuracy and in order to restore trust. And the last piece is around the increase in information, right? As I said earlier, right, and as David called out, right, price alone is not going to drive decision-making, right? We have to give consumers a picture of all of the value levers that they look for, whether that's availability for scheduling, whether that's overall affordability, right, the out-of-pocket cost, whether that is drive time, whether that is star ratings based on previous patient experiences. In the studies that Deloitte did back in 2022, those were the biggest drivers, right? And what we thought was maybe professional opinions, it actually turned out that they wanted to hear the opinions of their peers. So really taking a good look and expanding the information scope in those transparency tools will ultimately drive us closer to that 360 degrees of transparency. So moving on, and just to address one more question, I think we had a question come in from Tim around steerage impacting consumer transparency. And I think that's another thing we need to deal with in the industry in order to activate this consumerism. I mean, I think across the board, right, we all believe that consumer engagement in their healthcare is a positive thing. That's how we're going to drive health. So historical benefit designs that prevented choice, right? Because there really wasn't the tools and the data available to provide them with the capacity to make a meaningful decision, are going to need to evolve to be able to start to engage them in the way that they do. And that's what we believe transparency, as well as other healthcare transparency besides price, will drive in the future of health, right? Where the consumer is really at the center of their experience. All right, so now let's put our future caps on. We're traveling to the future. We're now in an all eyes on the money scenario. And this is the scenario we believe that we currently are in today. So it's not hard to imagine what this might look like, right? It's defined by data-driven competition, right? Intense focus on pricing data. It's being brought into negotiations. It's being used for network design. It's being used by hospitals for strategic decisions around M&A. And it's especially creating a set of out-of-network deadlocks. We've seen an increase of, there's some estimates up to 700%, right, of out-of-network disputes since price transparency became a regulation, a rule. Second is we still don't see the limited consumer engagement, right? So even with available information, we haven't seen a large engagement or change in behavior of consumers. And then there's a tension between price and value. Now that there's use by employers, by providers, by health plans, there's now a real need to be able to articulate the value associated with the price. And be able to measure, right, what is the balance between cost-cutting measures to get a price that's consistent with the market and continue to deliver quality of care. And again, that's going to sit in that value proposition. So some of the strategies that we might think of, right, as we look into this area is clearly, understand the data, right? If everyone's using it, we need to, no matter whether a health plan, an employer, a provider, understanding the data, understanding how your strategy relates to the data is going to be critical. So that's the data analytics tools. It also means for health plans being able to use it in sophisticated provider network optimization. It also means that starting to move beyond price, right? As price becomes a single focus, it does shift us towards discussions around value orientation, right? So beginning to mature your value-based care strategies is going to be really important here. Journey, but continuing to advance those value-based care maturity levels can be really important in restructuring your program so that you're able to grow that member base. Employers, right? The data, I think employers is one of the first time where you really have this data to be able to integrate into both your purchasing strategies, but also education of your employees to start to help them make better use of care and reduce your cost trend. And then lastly, with life sciences, clearly implementing value-based pricing models, aligning your drug costs to clinical outcomes is going to be a continuing important. And everybody creating a value proposition, making sure you can connect price to quality is really important. Realize we only have 8 minutes, so apologies for that rapid review of this. Any questions on this? Any thoughts that other folks have on what other strategies they're taking in this space? All right. So as we think of, just quickly, as we shift to the right now going into a, which we think based on, the consumer sentiment analyses that we just reviewed is a pretty near term trajectory. This is a new world, right? So we're now in a world where consumer decision-making has been empowered, right? Patients are actively engaging in healthcare choices. They have the comprehensive data sets of access and availability and user reviews and outcomes data at the disease level, where they're starting to be able to make a personal, digestible, and potentially digital user experience. We're also seeing holistic value-based competition. So as VBC matures as a result of that singular focus on price, we're starting to see healthcare providers compete for consumers on overall value, right? Outcomes, access, experience, cost effectiveness, all of those things, rather than just price or brand competition. So we believe that we'll start to see a lot more innovation as we move into the 360 degrees of competition market scenario. So what do we do as a result? I think clearly being able to provide consumers as they demand this access and we start to engage them in their care, developing AI guidance systems, right? Allowing them to understand the issues that they have, who are the best providers to treat it, and then showing them the data and giving them the choice in a digestible manner to be able to do that. I think second, and this goes back to Tim's point, is providing benefit designs that allow them to engage deeper in their healthcare and then share on some of the benefits, right, as they improve their health and as they improve the cost trend for their employer or for their fully insured health plan. As we think about what providers need to do in this space, right, it becomes really important to connect value to price. So thinking about value-based pricing, making sure they're continuing to stay on top of enhanced digital patient engagement and transparency platforms, making sure they understand how their data is being used in some of these third-party data platforms, and making sure they're connecting the value is going to be really important, right? The consumer becomes ever more important, specifically around these areas. And then employers, continuing to develop, similar to health plans, AI-generated, navigation systems, right? Helping them really digest that information to be able to make the right choice that ultimately makes them healthy and reduces your cost trend. And And again, for life sciences, very similar, looking at outcome-based pricing models supported by real-world evidence, developing patient-centric drug development and pricing scenarios. So I'm going to run to a poll here. I know we're running out of time. So what bold plays have you invested in or are considering investing in due to price transparency? Give me a couple minutes here. All right, in the matter of timing, we're getting close to a good representation here. So let's see what folks, very interesting, very consistent, I think, with our discussion. Accelerating value-based care, pricing contract simplification, starting to rationalize, right, prices so that it makes sense to stakeholders, whether it's health plan employers, and starting to link it to value so that it starts to align with what patients really care about, right? Outcomes, patient experience, and access. This is great. So just to leave you with a few things, I think what we learned going through this exercise with many clients, and I think what we learned collaboratively here today through the polling, is that whether we're in a all eyes on the money experience scenario or 360 degrees of transparency scenario, there's a few things that really are no regret moves, right? And I think that actually really came through in the last poll. Making sure you have a data-driven pricing and network strategy, right? Despite some of the challenges with the data, use a diverse set of pricing data sets to be able to align your strategy with market value with a deep understanding of how that connects to your value. And that drives to our second point, right? Really begin to articulate and incorporate pricing into your value propositions, right? Be able to speak to your unique, differentiated access, quality, outcomes experience, and how that aligns with your price relative to your peers. Start increasing collaboration. I think this is a really great opportunity to start enhancing education. Right? Price has been. I mean, I'm sure price is front and center to everyone on this call. But the majority of the United States, majority of professionals have a very low aptitude as it relates to what's a price, what's a charge, how does it all work, what's liability versus price, right? What's a discount, what's a contractual allowance. So educate, right? Make sure people are making the right conclusions around price. And then start to adopt through that, right, new engagement models that are centered around value, right? Whether it's a provider working with employer and direct to employer education or direct to employer models, there's lots of different ways to be able to collaborate across stakeholders to drive value and really have a win-win and grow the pie. And lastly, like every consumer is different, every market's different. So really start to get to understand your consumer and how they're starting to use this data to be able to empower them, right? Empower them, build trust in your organization, be that organization that's helping them navigate this really uncertain time, right? Where there's tons of information being thrown at them, and design it around them. Enable them to choose you, become healthy, and hopefully we'll be in a better place, as we move into these scenarios. So thank you for the time today. I realize we're at time. Any questions will be available to you or to any of you. We'll be sending some materials out, and we'll look forward to future conversations.